Here we will draw the descending spinal cord pathways in axial cross-section. Draw 1/2 of an axial cross-section of the spinal cord. Then start a table. Label the following terms across the top: tract, origin, termination, and function. Now draw the lateral corticospinal tract in the lateral funiculus and the anterior corticospinal tract in the anteromedial spinal cord. Indicate that the lateral corticospinal tract fibers originate in the motor cortices, most notably, terminate in contralateral spinal motor neurons, and innervate distal musculature for fine motor movements. Now label the somatotopic organization of the lateral corticospinal tract. Indicate that the medial aspect of the lateral corticospinal tract carries the arm fibers, and the lateral aspect carries the leg fibers. Next, indicate that the anterior corticospinal tract fibers originate in the motor cortices, most notably, terminate in contralateral spinal motor neurons, and innervate proximal musculature for gross motor movements. Then label the hypothalamospinal tract alongside the lateral corticospinal tract in the lateral funiculus. Indicate that this tract originates in the hypothalamus, descends ipsilaterally, and carries hypothalamic control of autonomic function. Next, in regards to the somatotopy of the anterior gray matter horns, show that posterior nuclei innervate flexor muscles, for example, biceps brachii, which flexes the arm. Anterior nuclei innervate extensor muscles, for example, the triceps, which extends the arm. Lateral nuclei innervate distal muscles, for example, the dorsal interossei, which produce finger spread. And medial nuclei innervate proximal muscles, for example, the deltoids, which raise the shoulder. Note that the somatotopic organization of the gray matter parallels the positions of the functionally related white matter pathways. For instance, the lateral corticospinal tract lies laterally and innervates gray matter spinal motor neurons that lie laterally and innervate distal muscles, and the anterior corticospinal tract lies medially and innervates gray matter spinal motor neurons that lie medially and innervate proximal muscles. Now let's address the functional role of the rubrospinal, reticulo, and vestibulospinal tracts. We address their anatomy in the advanced section of this tutorial. Indicate in the bottom of our diagram that in general, the rubrospinal tract originates from the midbrain and innervates upper extremity flexors, whereas the reticulospinal and vestibulospinal tracts emerge from below the rubrospinal tract in the pons and medulla and innervate extensor musculature. Now section off the right-hand side of the page. First, show a scenario wherein the cerebrum inhibits the rubrospinal tract and also the reticulo-vestibulospinal tracts. Indicate that this is the normal scenario. Next, indicate that when this cerebral inhibition is lost, these three tracts are left unchecked. The rubrospinal tract produces upper extremity flexion. The reticulo and vestibulospinal tracts produce lower extremity extension. In the appropriate clinical setting, this response is referred to as decorticate posturing. Now indicate that when there is a lesion at or below the midbrain that cuts off the cerebral suppression and interrupts the rubrospinal tract, the reticulo and vestibulospinal tracts are left unchecked. The reticulo and vestibulospinal tracts produce neck and limb extension. In the appropriate clinical setting, this response is referred to as decerebrate posturing. This ends our essential material. Now label the rubrospinal tract near to the lateral corticospinal tract. Indicate that it originates from the red nucleus in the midbrain, crosses in the ventral tegmental area of the brainstem, and innervates the upper cervical spinal cord to produce arm flexion. Next, label the tectospinal tract in the anterior medial spinal cord. Indicate that it originates in the superior colliculus of the midbrain, decussates in the dorsal midbrain tegmentum, and innervates the upper cervical spinal segments to activate neck movements and produce contralateral head turn. Now let's address the reticulospinal tracts and vestibulospinal tracts, both of which maintain posture through the activation of anti-gravity muscles. In our axial cross-section, adjacent to the anterior corticospinal tract, draw the medial reticulospinal tract, and adjacent to the tectospinal tract, draw the medial vestibulospinal tract. Then farther laterally, in the lateral funiculus, draw the lateral reticulospinal tract and the lateral vestibulospinal tract. Next, indicate that the medial, also known as rostral, reticulospinal tract originates in the medial zone of the pontine reticular formation and courses predominantly ipsilaterally to activate the axial and proximal limb extensors. Then indicate that the lateral, also known as caudal reticulospinal tract, originates in the medial zone of the medullary reticular formation and courses bilaterally to inhibit the axial and proximal limb extensors. And to a lesser degree, it also excites axial and proximal limb flexors. Note that intertextual discrepancy exists regarding the laterality of the course of the lateral reticulospinal tract. Next, indicate that the medial vestibulospinal tract arises from the medial and spinal vestibular nuclei, driven by the semicircular canals, and acts on the bilateral cervical spinal cord to excite neck extensor musculature. Now indicate that the lateral vestibulospinal tract arises from the lateral vestibular nucleus, driven by the otolith organ, to activate ipsilateral paravertebral and proximal limb extensor muscles. This concludes our diagram.